Hey guys, this is Dr. Maurice Skillen again, coming at you from Pain C. Sitting in my office right now. Wanted to create my next video covering issues I've come in contact with while being in the military and CMP exams as I've seen them. And I want to premise everything I'm about to say with this. I don't have anything against the military. Love it. It's helped me in my life. It put me where I am now. Have nothing against the military. Have nothing against the VA system. I'm seen at the VA system. Love it. Okay? Go out there and get done what I need to be done. I have nothing against any veteran I've ever seen or had the pleasure of taking care of. And I am not casting any stones. What I am doing is sharing information with you. So on the front end of this next video, understand what I'm doing here, okay? And it's my hope that from the experiences I share with you of things, in some cases, that have happened to me directly, or things that have happened to soldiers, sailors, airmen, Marines. That's an important thing to me. I take care of them all. You know, I'm Army, but it doesn't matter. Situations I've come across with military personnel post-military duty and in their afterlife and performing compensation and pension exams and that sort of thing. I've been a PA, about 20 years now. In that time frame, served in uniform, out of uniform, the whole nine, worked at the VA. So I'm sharing with you knowledge that I've gained through that process. But this is not a get over on a VA video. This is not a mad at the military video. This is not a mad at the VA video. Again, I'm sharing knowledge with you that I hope will help you moving forward with your family and with your medical care, and making suggestions based on what I have seen, what I have experienced, that I am still experiencing. I have people call me all the time to ask me a couple of questions here and there. I give it up because they need to know, okay? That's what this whole series of videos is about for me, sharing knowledge so that, you know, veterans will do well. There's some out there. I'm gonna tell you, my son said to me the first week he worked with me in this clinic that he enjoyed coming in here, that he enjoyed helping out the veterans that had come through. The veterans I seen that day touched him enough to where he's developed a passion to do it. And that's where what I am going to talk to you about comes from. Not from hate, not from anger, anything like that. It's from paperwork. It's from rules and regulations I'm aware of. It's from situations I put my hands on. And it's from questions I've been asked. If asked why I do what I do and why I'm doing what I'm doing right now, my answer is in short form. I do it for the veteran as well as the veteran's family. That's important. If a veteran is injured to a degree that they can't work, they're not the only ones that suffer. Their families suffer too. So I wanted to give that little caveat before I got into the next video, which will start soon. And I'm going to try to get out of here now. I've been in the office all day. So I'm going to try to get out of here now, and I'll get this video up as soon as possible, guys. Take care. Hello, everyone. This is Dr. Maurice Skillen coming at you again from Pain C. Here today to start another video that will give you information on compensation and pension physical exams, and some information on the paperwork, which is secondary to the physical, the most important thing. If the paperwork isn't filled out right, or if the paperwork isn't submitted appropriately, it'll be kicked back, held, or in some way not action upon, so to speak. So to avoid those issues, I'm going to kick out a little bit more information. What I decided to do after the first video, by the way, thanks to everybody that reached out to me after that first video. It was a long one, but I appreciate you guys taking the time to look at it, and there was valuable information within, which for the last week I've been answering questions about that I hope will allow them to go ahead and file a compensation and pension exam appropriately. But getting back to the subject matter, compensation and pension, what does that mean? And this is another aspect that I've decided to do. Some of the questions that were asked of me over the last week were basically, what is it? How do you do it? How do you start it? I didn't know about it. What do I need to do at this point? Those questions were asked over the last week also. So I'm gonna take a step back and cover things from where they begin. And instead of doing a long, drawn-out video, I'm gonna chop it into sections. This will be section 1 of a series, and we'll start at the front end of everything. The front end of everything begins when an individual decides to go into the military. That's really the preparatory start of your military career. And what I mean by that is this. Once you make that decision, sign up, go into the MEP station, get all the examinations and whatnot, and you're cleared and you move forward, you get what we call orders that are sending you to a particular military base to start your basic training, okay? That's the start. And from the start, there are important factors in what's going on that you need to be aware of, pay attention to, and try to get some documentation on if you can. But if not that, just be aware of it. From that first MEPS physical, that's a military entry station physical. It's going to be a provider, doctor, lawyer, Indian chief, no, not really, but doctor, PA, nurse practitioner, provider will be there that will do a physical exam on you. Now that physical exam is supposed to be a very thorough exam that both documents real time, at that time, status of your current medical condition, okay? So they're gonna look at ear, eyes, nose, throat, chest, heart, abdomen, lumbar spine, cervical spine, ears, and all of those things. And they're also gonna record any pre-existing conditions that you may have that have not been mentioned yet. Maybe you forgot about them, but if they see them or find them or note them, they're gonna put those in the CNP exam or in the MEP station exam, which is completely different from the CNP exam. Let's not get mixed up on the front end. So the MEP station exam, entry physical, is gonna cover those issues. And if you do have pre-existing injuries or pre-existing conditions, they can, in some cases, disqualify you. And let me give you an example, okay? I had an individual when I was working at a military post somewhere that came in, he was in basic training, but came in, or she was in basic training, it doesn't matter who it was. They were in basic training, and they came in to see me at a troop medical clinic, okay? Now at that troop medical clinic, they came in for hip and lower back pain, okay? These are things that are not unexpected. In basic training, you're doing things that you've probably never done in your life, unless you played football, basketball, ran track, or those things. If you've done those things, then you may be familiar with some of the things you're gonna do in basic training, but there are gonna be a lot of things you're not familiar with. You're gonna be asking your body to do things that you haven't asked it to do before. And those are things you have to do, say, and demonstrate to get through basic training, okay? It's not a free ride, especially the Army and the Marines. None of it's a free ride, but especially in those areas. So you can have injuries, you can have illnesses, you can have situations that injure you. So be aware of those things and be cognizant that those are important. And the reason I want to emphasize that is this. If you sustain an injury that does not let you go beyond basic training, Okay, you can't function. That could be a hip injury, some significant injury in basic training that will not let you go on. Then you'll probably be what we call, what they might call it something different at this point, but you're chaptered out. Chaptered out means you go through a process, you fill out paperwork, they evaluate you. Once you're medically found to be unfit, that's kind of a harsh way to put it, but once you're found to be medically not able to go on due to an injury that you may have sustained in basic training, they chapter you out or send you to the house, as we call it. And if that happens, though, you still have the ability to have a DD-214, and you still have the ability to be seen at the Veterans Administration Hospital. And there's some special conditions there, but you did sustain an injury while in training to enter the military, which should kick you out a DD-214 or some document of some type that should allow you to be seen at the VA hospitals or within the VA system, okay? And that reasoning behind that is the injury you sustained was in some way sustained while performing military duties. Yeah, even in basic training, that means something. But, and I didn't, but what you need to understand is you sustained an injury in basic training, one that was significant enough to send you home. And in that particular case, the injury has some call on what you can have done by the VA, what you can be seen for through the VA. And the principal focus on that is going to be that you can be seen for that particular injury at the VA. And we should, or the VA, I'm not working there anymore, or the VA should have a responsibility to take care of that injury, because it was sustained in the process of trying to get into the military, and it was significant enough for you, the injury you sustained, to have you sent to the house, okay, with whatever paperwork they give you. But there's a very, very important caveat that needs to be added right here, because I've seen it a million times. Now, in that process of you leaving the military, after you sustained the significant injury that was enough to get you sent to the house, okay? Going through that process, they may offer you some money, okay? If they offer you money, this is a very important decision that you have to make. If you're currently in that situation and you're watching this video, this is just my advice, and I'll tell you what it's based on in the long run. But if they offer you money, and if it ain't $1.5, $2-3 million, it's not gonna be enough to sustain you for the rest of your life, okay? Whether it's 30,000, 40,000, 10,000, some big number that excites you because you maybe never had that kind of money in your hands or in your pocket at one time your whole life. That's a wonderful thing to get 30 G's, but there's some things you need to understand about that $30,000, okay? First and foremost, it's gonna be taxed. The government's gotta get its piece out of whatever money you put in your pocket. So that's gonna lower that 30,000 to some lower number. I'm not a tax expert, but it is gonna impact the amount that you actually get, okay? Number two, in that process of signing that document, okay? This is not to beat up on the military. This is not to beat up on the VA. But in the process of signing that document, accepting that money, in many ways, what you're saying is, okay, I injured myself. They're gonna pay me out, or pay me to go to the house, or pay me out of the military. They're gonna give you a pocket full of money to go to the house, basically is what you're looking at this point, okay? Now, in that same paperwork, I've seen it a million times. you are actually signing over your right to make any claims on that particular injury for the rest of your life. You're doing that when you accept that $30,000 or something less than $30,000 after tax. You're actually signing away some of your rights to that injury. Now, let me give you a for instance. If you go through, sustain an injury, you're sent to the house, and you opt not to accept the money, okay? Then you can, at that point, leave, go to the house, and then be seen by the military for that injury, okay? And in some cases, emergency cases, you've got a DD 214, you can go to the VA for emergency reasons, okay? But the principal thing that you're going to be covered for on your way out, they're going to fill out all this documentation. They need to write it down. If you're somebody out there that knows somebody in this situation, if you're a mother, father, sister, brother, talk to them if they bring this up to you. If they're asking you, do you think they should give the money, or if they ask me, I would say no. Unless it's 1.5, 2, 3, $4 million. Uncle Sam is going to still get his piece out of that. But you may have a significant enough money at that point to sustain you for the rest of your life, or to sustain you until you can be trained into another profession, okay? So please, if you're in that situation, and again, I've seen it 1,000 times. I've had soldiers or sailors, airmen, people that tried to go into the Marines or all those places, come to me and ask me, what can I do? The short answer to that is you basically signed away your rights when you accepted that money. Now, after the fact, you're complaining, but by this time you've accepted that money, you spent it, okay? But again, unless it was $1.5 to $3 million, it was never going to be enough to sustain you for the rest of your life. Now you may have an injury that affects your ability to work, and you have no rights to go back on the military for that injury. Because remember, they paid you to go to the house, okay? I've seen that. I've still taken care of patients that veterans that have come through when I was working at the VA that came through with that reasoning. And if they got to me in orthopedics and they said I could see them, I saw them and I took care of them all the way to all the conservative, all the injections, all the way to, well, I dressed up everything and shipped them to the surgeons to be evaluated for whatever problem that was. Why? Because my conservative methodology failed for whatever that injury is. Okay, that's if you get to me. If you have signed away your rights, and okay, again, I'm not legal. I'm not even, I would say, highly trained on the paperwork. But what I do know is that I have an experience of seeing this. And it's not a good thing to have an individual sitting before you telling you, hey, look, my hip, I broke my hip, I broke my femur. While I was in basic training, they chaptered me out. They sent me to the house. Now I can't work because this thing is killing me on just about any job I try to go on. What can I do, Mr. Skiller? Well, my answer to that when I was working for the VA was this: let me get you with one of the VA reps. And as a matter of fact, let me make a phone call to call them and tell them or ask them if they can see you today because you're here today. And if need be, I would walk them down to the office. Why? Because I'd want them to get the information from resources that can really tell them. What do I know from my experience is this: once you accept that money and you sign away those rights, filing a claim that would get you a disability compensation and pension check every month is probably not going to happen, okay? Why? Because again, you signed away your rights, even though you were injured in the military, because you were in the process of going in at basic training, okay? Theoretically, you don't enter the military until you finish basic training, okay? And I tell you what, let me get back to the individual that I brought up a while back. And this means I do have a decent memory, okay? So the individual who I seen a while back when I was still in uniform, still working at TMCs, he came in. He came in for low back pain and hip pain, one of the hips. I don't remember which hip, but it doesn't matter. It could have been either or, okay? As I was looking at this individual who came in for low back pain and one of the hip pains, when I looked at him from the front as well as from the back, I noted that his hips were not equal, okay? The iliac crest, they were not equal. It should be equal straight across. If you're standing on both feet with feet together, anatomically, that's what it should look like. I wasn't seeing that. When I examined him further, I looked at one of his legs. He had a significant scar on one of his legs. And when I asked him about it, or asked her about it, they told me that they had broken their tibia and fibula in the past. The tibia is the big bone in the lower part of your leg. It takes a lot to break that thing. And the fibula, it's not a highly weight-bearing bone, but you know, if it's broke, it's broke. So he broke both of them, which was a significant injury. And if he had a comminuted fracture or something, they had to go in there and put plates and screws in there to hold it together, to let the bones remend together, both bones, okay? That was a serious operation. He had this before he came into the military, and I was seeing him in basic training for low back pain and hip pain, okay? After that finding, further examination, seeing the scar on his lower leg, examining him further, his hips are not meeting, I laid him down. And I did a leg length test on him, which is laying him on his back, grabbing his feet, pulling them toward me, and his ankles should meet up equally, okay? His ankles did not. One of the legs was shorter than the other, okay? With that test, I found that. Okay, why that wasn't found in the MEP station, I don't know, but I found it then, okay? That leg length discrepancy is what was causing him the pain and discomfort in his lower back and his contralateral or opposite hip, okay? That's what was causing it. Could we fix that? No. Is he eligible to go into the military with that? No. Okay? So what I had to do was start the paperwork to chapter this individual out. I can't say there's no way he could have made it through basic training. If he would have sucked it up and no provider would have ever had to see him for that complaint, hip and back pain, he might have got through the process. Why? Because we depend on MEPS to do a thorough physical for these dudes to come in. That's not beating up on MEPS. I'm not doing that. But this guy slipped through the crack. He got to me for these complaints. And again, once I seen it, once I documented it, there is nothing I can do as a provider to stop this process, okay? I can explain why your hip and your lower back hurt. You have a leg length discrepancy that makes you walk and run this way. That's gonna put undue stress on your lower back and the contralateral or opposite hip. It's obvious. In basic training, you're gonna have a rucksack on your back carrying all kind of equipment, especially when you're out there bivouacking in the woods. So that's gonna aggravate that area, which is what was faced then, okay? This was a pre-existing condition that had nothing to do with the military, that wasn't caught when he came through MEPS, okay? So that's where things ended for that individual. But again, we're on the front end of everything, and I felt it important to start here because really until you get through basic training, any injury prior to then is gonna be looked at. If it's a congenital injury or a sustained injury before the military, you're not gonna get anything for that because the military had nothing to do with that injury. Or if you sustain an injury after you get to your basic training, after you get through basic training and you go to your permanent party. If you have a sustained injury, a significant injury, 1 week, as much as 1 day, 2 days after reaching it, getting done with basic training, getting to your first duty station, 1 to 2 days after that, which means you made it through basic, you didn't have any injuries or anything like that, you got to your first duty station, and you sustained a significant injury. At that point, if they send you to the house saying that you can't no longer perform your job because of the injury, whole different ballgame. You're in the military at that point. You sustained an injury while you're in, whole different ballgame. Okay? Are they going to offer you money then too? Don't know. But they might. But still unjust, it is my opinion to you. Okay? And I don't know what your financial state might be or might have been in the past, but it's my advice to you. Don't accept that money. Don't give up treatment for that injury for the rest of your life for $30,000, $40,000, $50,000. I'm going to tell you, you're going to have an issue. Because if you get out and that injury is what's causing you problems in your civilian life, working on a job, finding a job, the military paid you to go home and they're not going to have any responsibility for that, to my knowledge. I've heard of people fighting it, but I've never heard of anybody winning it. Why? Because even though they were young and that money looked good enough for them, they were considered adults when they signed that paperwork. And when they did that, they gave up all rights to a claim after the fact. So really let that sink in. Injury and basic training, they got sent to the house. They gave up all rights in accepting that money to claims after the fact. And again, I don't know your financial status, but if you're in this situation, I wouldn't take that money. I just wouldn't. And again, I'm bringing this up because I've seen it so many times, and as much as my heart bled for the individuals, there was nothing I can do as a in-uniform provider in the Army or as a provider working for the Veterans Administration Hospital. There's nothing I can do. I can do a hell of an exam. I can document it. I can x-ray it. But I can't change the fact that you signed away your rights. Remember that. Okay? Pass that on. If you know anybody that may be in that situation, pass it on to them. Okay? So again, we've covered a little bit of, well, we basically covered all that I really want to cover this particular video. And it's, again, to keep it short. The last one was 1 hour and 20 minutes. So this one is going to be short. And I'm going to do as many sessions as I need to talk about the whole CMP process. But just to go over what we've just covered, we talked about soldier, decide they want to be in the military. They go through the process, sign the paperwork, go through what we call the entrance physical at the MEP station, and they're found to be okay at the MEP station, and they're sent on the basic training, okay? At basic training, they're doing okay initially, but they sustain some kind of injury in basic training, okay? The military bears some responsibility for that because you were in basic training when you sustained the injury, and if it's significant enough to send you to the house, they bear some responsibility for that because that particular injury might be significant enough to affect your work life from that point forward. And that's that basis that I'm talking to you from, okay? Now, in the process of chaptering you out for that significant injury that would not let you go on, and let me tell you something, this is how it's done. When you sustain such an injury, they do, in some cases, allow a convalescent period, okay? And they recycle you, is what it's called. If they recycle you a couple of times and you still can't move or get beyond basic training, perform everything that's required of you to get through basic training, then you're going to be sent to the house, okay? Chaptered out, whatever you want to call it. once you're in that situation, again, what I've covered is you're going to go through a process where you're going to be boarded out of the system. And in every phase, they're going to talk to you. They're going to have you sign paperwork. Be cognizant of what you sign and make sure that's what you want to do. Okay, they may not express it like I have, but I'm telling you, really think about signing that paperwork, especially if it's dealing with money, paying for whatever that injury is. Because once you sign that paperwork and accept that money, remember, that money may be $30,000, but after taxes, it may be significantly less. Uncle Sam's going to get his money. It's going to be less, and it's not going to be, in most cases, enough to sustain you for the rest of your life. This is what you should be thinking about before you accept any money. But if you accept that money, sign that paperwork, in many ways, you're signing away your right to submit a claim for that injury, go through the compensation and pension exam process, and perhaps get money for the rest of your life. Whether it's for a knee issue, or whatever the issue was. Look at it from a perspective of the rest of your life when you're dealing with this, okay? And again, unless it's $1.5, $2 million to me, I'm not going to accept that money because, I mean, but I'm looking at hindsight. I'm medical, I've seen it, I know it, but I wouldn't do it. So let this be a video warning to you. And if you know folks out there that are in this situation, going through this process, please tell them to think real hard about every document they sign. Okay, and that's before you can even get to me and do any of the CMP process to get compensation and pension for the rest of your life. And we're going to move a little bit further with that thought process in the next segment. Okay. I hope I've covered enough here to give you an idea of where I'm going with the thought process. I'm going to go from there, move on into the CMP process, into what I do, what paperwork I submit, and how it's submitted to the VA. And as I said in the prior video, I am contracted by way of the companies that got the big contract from the VA to expedite CMP exams. So the patients I see are people that are sent to me to expedite their CMP process, where I do the exam, fill out all the compensation and pension paperwork for that injury, and submit it to one of the companies. They review it, and then they send it forward to the VA, who makes the final decision. And like I said in the first video, I have no control over that process. No provider does, but we have control over doing a damn good physical exam for you. Okay? And I'm going to add one thing about that, and then I'm going to cut this video out because I don't want to be long-winded again. And this is my medical history, so I can share it. I had a Nissan funnification while I was in the military for very, very, very bad GERD, gastroesophageal reflux disease. Acid was coming back up into my throat, causing me significant discomfort, bad enough to where when I was lifting or doing something, I would have to stop what I was doing, go take Tums or something to settle it down before I can continue that activity. So I had an operation. They did it laparoscopically, which meant they went into my stomach with little holes, and they did it all by the little laparoscopic instruments, okay? And it's called a Nissan funnification. After that surgery, I can't throw up anymore. Nothing can come up anymore because they take a part of your stomach and wrap it around your lower esophageal sphincter to give it support and basically shut it down, okay? Nothing comes back up. So if I get sick in the stomach, I got to wait to go to the bathroom the other way. So I'm just letting you know how serious that is. But at any rate, I was being evaluated for the scars that were on my stomach for this, okay? And at the time, I was working at the VA. Because I was working at the Memphis VA, they wouldn't let me see any providers at the Memphis VA for this particular claim, okay? The thought process is You probably know them. They're going to show favoritism to you. So we can't let any of them see this. If a provider worked at the VA while I was working there, I supervised an orthopedic clinic. 9 times out of 10, they did know me very well because I gave classes on orthopedics to primary care physicians and fielded most, if not all, of the calls that came into the orthopedic clinic and talked to them and went down to see their patients. So they probably did know me or would know me if I went to see them. So again, the thought process was, you can't be seen there. We got to send you to Nashville. Okay, that's fine. 3.5 hour drive. Okay, that's all good. I'm going to do what I need to do because I put in this claim. I'm going to follow through with the paperwork. So when I get to Nashville and get in with this provider, he asked me just a few questions. After that few questions, he told me it was over. Okay, let me share with you what I'm thinking. I made a 3.5 hour drive for you to ask me, 4, 5, 6, 10 questions? Hell, you could have called me on the phone for that. What did I make a 3.5 hour drive for? This is just my thinking. I was pissed. And I'm going to be honest about it. I was less than happy because I had driven 3 hours for a compensation and pension exam where the guy asked me 5, 10 questions, never touched me, never looked at the scars, had no idea where they were, and then told me that was it. Mr. Skillen, you can drive on. Go on up the way. I was incensed. After I explained to him who I was and how a CNP exam should be done, he commenced to take care of his business, okay? And that's the way that it needs to be addressed. If I'm entrusted to do a compensation and pension exam on someone, this is me, I'm gonna do the best damn exam I can as a provider. Why? Because that's doing justice to this veteran who has served in uniform, sustained an injury in uniform, is bothered enough by it after their military time to where they came in to see me for a CNP exam. I'm gonna do a damn good exam. That's just it. There ain't no ifs, ands, or buts about it. There is no negotiation. I'm gonna do everything needed to give the best exam possible. Why? When that paperwork goes forward, when it gets to the VA regional office or whoever decides, they're going to depend on that information to make judgment on if the veteran is service connected for that injury and compensated at what rate. Important stuff. That means that physical exam that I do or any provider does, that compensation and pension exam, needs to be seriously done with the utmost of focus. I'm going to share with you right now. People that have seen me have said, I've never seen anyone do it this way. They probably not. Probably will never see it again. This is how I do my CNP exams. I don't play with it. I don't cut corners. I'm up late at night finishing paperwork, researching. Why? Because, and this is what I tell every veteran, I'm not just doing it for them. Not just doing it because they took the challenge, put on that uniform, went where they were told to go, did what they were told to do, sustained an injury that affects them right now. Not just for that. I do it for their families. This is what people don't realize. If a veteran is hurt so much where they cannot work, who suffers? Not just the veteran and their family. Okay? Thus, again, my seriousness with these exams Goes to the extreme because it's got to be done right, okay? Can I say every provider does that? Nope. Comes down to what I told you about the provider I drove 3.5 hours to Nashville for. He didn't touch me. He didn't look at my stomach. He didn't examine me at all until I dug in. Why? Because it pissed me off. Even more so because I know that there were other soldiers, sailors, airmen, Marines before me who he may have done the exact same thing on. So it wasn't just for me that I was pissed off. I was pissed off because of the way he did what he did or didn't do what he was supposed to do. Keep this stuff in mind, guys. I'm just trying to give you nice little pearls, okay? And that was going to be the first segment of this series, okay? The next segment, I'll go on from where we are now. We're in basic training, sustained injury, went home. Now we're going to move on. You went to basic training. You did okay. You passed everything in basic training. You got to your permanent party area and your first duty station. So you're already there. At that point, you sustained an injury. Or sometime after you started your military career, you sustained an injury, okay? That's where I'll start in the next segment. We'll talk a little bit about such an injury, why you're still in. We'll talk just a very little about the medical chaptering and all that stuff. I'll hit it lightly. And then we'll move on from there to what may happen after you leave the military and the CMP exam. So it's going to be at least a 3-4 part series, guys. But again, I'm going to keep it nice and short at this point. So that's going to conclude what I'm going to cover today, okay? So I'll see you guys next week. Listen, be safe out there. Stay in as much as possible. Try to avoid any enclosed areas or anything and big crowds, guys. Parties, just not worth it these days, guys. Just not worth it. People are sick. People are dying. The coronavirus is real, and it's not playing. Okay? So take care. Be careful. Be safe. And be well. Take care. Out.